Today we're here at Highlands Vasectomy Clinic on the Bristol, Tennessee side of Bristol. I'm joined by Dr. Greg Griffith. Doctor, thanks for having us out today. A very unique practice in that vasectomies are the only thing that you do here.
Correct. For the last 3 years, vasectomy has been exclusively my practice.
And do you find, when someone decides that a vasectomy is the way they want to go, it starts with a conversation with their significant other?
Correct. Usually it starts with the wife telling the husband, it's time you get this taken care of.
And so they come in and you are the only no needle, no scalpel vasectomy practitioner here in the Tri-Cities, correct?
Correct.
Talk to us about no needle, no scalpel. What does that entail? I mean, it sounds pretty painless.
Most urologists have been doing a no scalpel procedure for 15 or 20 years.
Right.
That's no different. The benefit up here is that for those that don't like a needle or particularly needle phobic, we can use essentially a hypospray, which will inject by a jet stream a small amount of lidocaine beneath the skin rather than using a needle.
And you actually have one over here if you want to pick it up and show it to us really quickly, that it's just a real simple procedure.
Sure. It's actually old technology, like they used to do mass immunizations.
Right.
You put that right up on the skin,
Right.
with the little tube right underneath it, and it shoots a little jet of lidocaine through the skin, which still stings just a tiny bit,
Right.
but more like a little rubber band snap than that sharp pain you get with a needle.
And some people just cannot deal with needles. That's just a phobia for some folks, and that helps alleviate and give them some confidence in this procedure.
And most people are fine if they don't see it, which it's a hard area to see.
Right.
But truly a vasectomy is harder for guys between their ears than it is between their legs.
Now, explain the vasectomy procedure. How from beginning to end, what does a gentleman have to go through when he comes in to visit with you?
They'll call. They, as a rule, don't need a referral. Most major insurances cover vasectomies. We'll bring them in for a little 30-minute chat and go over everything they need to know, and usually the following week, either Thursday or Friday evening, sometimes Saturday morning, they'll come in and have their procedure. We'll hand them the little tablet. They'll pick out their musical genre of choice on Pandora, and on average it takes about 3 songs to do the procedure, although they're here for on average 45 minutes.
And there's a follow-up visit after the actual procedure is done.
Want to check and make sure that what we said we were doing was successful.
Because you're still fertile for a couple of weeks after you have the procedure done, and you have to come back in for that follow-up to make sure that everything has been taken care of.
Absolutely true. We say people are sterile on average between 2 and 4 months, but most guys have a normal ejaculate for at least 2 to 4 weeks.
And do you find that a lot of guys come in here with a lot of trepidation and leave with a lot of confidence when you give them some assurances about what's going on?
Yes and no. I think a lot of guys have some anxiety about
Right.
vasectomy, and that's why that old saying of vasectomy is harder between your ears than between the legs.
Right.
It's actually easier than going to the dentist. It's not near as painful as that needle in the back of the jaw, and it's so quick and simple with lay up 24, 36 hours, and then people are up and around doing normal stuff.
One last question. You are one of the sponsors for our mother-daughter lookalike contest that we're having for Mother's Day, and you want to let the ladies out there know that you're here as well, practicing here in Bristol.
And as a rule, the discussion with the family usually starts with the wife pointing out to the husband that it's time for them to make a permanent choice, and this is by far simpler, easier, less painful, and much less expensive than some of the other options long term.
All right. Dr. Greg Griffith, thank you so much for having us in today. It is Highlands Vasectomy Clinic right here in Bristol, Tennessee.
The preceding portion of Daytime Tri-Cities was sponsored by